What is prolonged exposure therapy? Prolonged exposure therapy is an evidence-based treatment for trauma and PTSD that helps people reduce trauma-related symptoms by gradually and safely approaching memories, feelings, and situations they've been avoiding since the trauma. And as we get into this video, tell me, what do you want to know about prolonged exposure therapy? What questions, worries, or assumptions come up when you hear the word exposure? Leave them in the comments so we can talk about it. Oh, and if you don't know me yet, hi, I'm Dr. Jenny Hughes, trauma psychologist and founder of the Brave Trauma Therapist Collective, where we make sure trauma therapists actually have something left for themselves at the end of the day. Now, when it comes to prolonged exposure therapy, or PE, sometimes the name itself is a distraction. Not because people don't understand the words, but because the word exposure gets interpreted as pain. Understandably, people hear that and think that exposure means being pushed, flooded, or forced to tolerate distress without choice. And that assumption alone can make PE sound harsh, outdated, or even unsafe. But that interpretation misses what exposure in this context is actually designed to do. You see, prolonged exposure isn't about proving that you can survive pain. It's about helping the nervous system learn something new about safety, control, and the present moment. Prolonged exposure was developed in response to a specific clinical pattern seen in PTSD. Because after trauma, fear responses don't just fade with time as much as we wish they would. The nervous system instead learns to associate certain memories, sensations, and situations with danger, even when the threat is no longer present. And avoiding those things, it reduces distress in the short term, right? That works. But clinically, it also prevents this corrective learning for your brain and body that's so necessary after a trauma. And so the intent of prolonged exposure is to interrupt that loop by approaching feared memories and objectively safe, but albeit triggering situations in a structured, repeated, and supported way. And with this, because of these processes, the nervous system then has an opportunity to update, not through reassurance or logic, but through experience. And that is powerful. Okay. The learning happening in your nervous system in prolonged exposure therapy never says this doesn't hurt. Okay. The learning is this hurts, this approach hurts, and I can stay present, grounded, and safe while it passes because it will go through its natural beginning, middle, and end. Okay. So as you hear that, check in. What is it bringing up for you? And maybe you drop an emoji to let us know. So, what does prolonged exposure look like in practice, you ask? So, PE is a really structured therapy. It has a manual and a protocol, and that structure is part of how safety is maintained. Sessions, you know exactly what you're going to be doing in each session. They're planned, they're collaborative, and goals are discussed very openly. And the pacing is super intentional, right? We're not going for the hardest thing all at once. And in practice, PE usually involves working in two different areas. The first is approaching trauma memories in a contained and supported way, with the therapist helping the client stay oriented to the present rather than becoming overwhelmed by the past. The other is gradually approaching real life situations that have been avoided since the trauma. We call these in vivo exposures. And they're things that the person avoids even when they know that logically they're now safe. So, for example, someone who is in a car accident avoids driving, okay? And this whole process, both of these forms of exposure, again, it's not about jumping to the hardest thing first. That is the last thing that you want to do because it's going to prove to your brain and body that everything you've been avoiding clearly is dangerous. Instead, in PE, we're building tolerance and confidence gradually over time within your brain, your body, and your relationships. Okay. And the trauma therapist role is not to push or override you, but to track regulation, notice shifts, and help you stay connected to the present moment while you're doing such difficult work. That's the first relational repair in PE is through the therapist and the client. So is this surprising? Is this similar or different from what you expected prolonged exposure therapy to look like? Let me know, because we all come up with stories and narratives to help understand unknown and important topics, which is how a lot of the misconceptions and myths about prolonged exposure therapy have come about. So let's talk about them. The first is the fear that exposure means being re-traumatized or overwhelmed or pushed into something too intense too fast. That fear makes sense. And I've talked a little bit about this already. But trauma, when you experience trauma, it by definition involves a loss of control. So, of course, the idea of revisiting it feels dangerous. But prolonged exposure therapy, when practiced well, is again not about flooding the nervous system. It's about titration, which means exposure is paced slowly over time. There's a plan. You're working with your therapist on this. We have all of it structured out. And if and when you become overwhelmed or you dissociate or lose your ability to stay present, that is not evidence of a failure or success. It's a signal to slow down and adjust, because exposure is meant to support nervous system learning, not overwhelm. And yeah, discomfort can be and is part of the process. Doing trauma work doesn't always feel good, but overwhelm is not the goal. Okay. Another common misconception is that once exposure starts, the therapist decides what happens next, and the client just has to endure it, being forced to do things that they're not ready for or don't want to do. And that is not at all how prolonged exposure is designed or meant to work. PE, I've said this already so many times, it is collaborative. You are working with your trauma therapist every step of the way. Goals are discussed openly, pacing is negotiated, and consent is ongoing. Approaching avoided memories or situations happens gradually, and you as the client have agency throughout this whole process. And if someone doesn't feel ready, that information matters. And again, it is not a sign that you are weak, not strong enough, any of those, okay? Readiness isn't something to override. It's something to work with. And a skilled PE trauma therapist will have this top of mind throughout the work. Next, let's talk about the belief that if I start exposure, I'll lose control or fall apart outside a session. Such a common worry, right? That exposure is going to destabilize you between sessions. Makes so much sense. And it's not unique to PE either. I hear that from clients who are doing any number of trauma therapies with me. The thinking often goes something like this, okay? What if I open something I can't close? What if I can't function the rest of the day or the rest of the week? What if I never stop crying? This fear often comes from the reality that avoidance has been doing an important job. It's helped keep life manageable, right? It's a really good way to cope. And prolonged exposure isn't about removing that protection all at once, but gradually, we've talked about this, gradually building confidence that distress can rise and fall without taking over everything. The final misconception that I want to talk about today is the belief that if exposure feels hard, it means I'm doing it wrong or I'm not cut out for it. Now, this is a really common fear that often shows up once people start the work. They feel the discomfort, or things naturally start to feel worse before they feel better, spoiler alert, and then immediately assume that something's gone wrong. But difficulty does not automatically mean failure. Learning happens right at the edge of what's familiar. When the nervous system is doing something new, it feels uncomfortable, even when the work is unfolding as intended. And what matters is whether the person can stay present and supported, not whether the process feels easy. So remember, hard doesn't necessarily mean harmful, and struggle doesn't mean that you're failing, okay? As you listen to all these misconceptions, what are other ones that I can answer for you? Drop them in the comments. I hang out there and I will give you my best answer. Now, let's talk about fit in terms of like a good fit for someone, readiness and timing of prolonged exposure therapy. Because while it can be highly effective, readiness and fit and timing isn't about being brave enough or strong enough. It's not a moral category. And especially when it comes to readiness, it has much more to do with support, stability, and capacity. Some people benefit from doing prolonged exposure early in treatment. That could be a readiness thing, a fit thing, a capacity thing. And this is often happens when trauma symptoms are really clearly organizing their life around avoidance. For others, it's more helpful to start by building regulation skills, strengthening support systems, or establishing a sense of safety in the therapeutic relationship first. Neither path is better or worse, okay? What matters most is whether someone can stay present with distress without becoming overwhelmed or shutting down, and whether there's enough support to help them recover between sessions. And that support could very well come from the trauma therapist, from relationships outside of therapy, or from internal resources that have been built over time. Readiness can and does also shift. Someone may not be ready for exposure work at one point and become ready later. Or they might start PE and realize they need to slow down or hit pause. That doesn't mean something went wrong necessarily. It means the nervous system is giving feedback and it deserves to be heard. And for therapists, prolonged exposure can bring up its own edge. This work asks therapists to tolerate discomfort without rushing to soothe or avoid. It requires trust in the process while staying deeply attuned to the client's nervous system. It also requires support for the therapist. Doing exposure work without consultation or community can increase therapists' anxiety, avoidance, vicarious trauma, and compassion fatigue, even when the model itself is sound. PE is not just about following a protocol. It's about holding steady, staying regulated, and knowing when to slow down. For therapists watching, how does this land for you? Does it feel grounding, intimidating, both? Let us know. Now, at its core, prolonged exposure is not about forcing people to face their trauma. It's about helping the nervous system learn that the present is different from the past. Avoidance makes sense. Fear makes sense. Needing support makes sense. Healing doesn't happen by erasing those responses. It happens by meeting them with structure, safety, and relationship. And no model replaces attunement. No protocol replaces presence. And no trauma therapy works without a regulated human in the room. So if you're watching this as someone impacted by trauma and you're wondering whether prolonged exposure might be a fit, the next step is usually a conversation, not a commitment. That could be with your current therapist, a prospective prolonged exposure therapist, okay? And if you're a trauma therapist watching this and feeling the weight of doing all this work, you don't have to carry it alone, I'm telling you. Inside the Brave Trauma Therapist Collective, we talk about how to do trauma work in a way that's effective and sustainable without asking therapists to sacrifice themselves in the process.